Hi, my name is Elizabeth McBride, and this is my presentation on catheter-associated urinary tract infection, or CAUTI, prevention. Here you will see the table of contents, which lists the order of information that's going to be given. First, what are CAUTIs? Second, the significance to nursing. Third, the CAUTI prevention plan. Fourth, the microsystem approach. Fifth, the macrosystem approach, and lastly, measures with nursing informatics. A catheter-associated urinary tract infection is an infection that occurs when bacteria enters the urethra via urinary catheter. Urinary catheters are placed to drain urine for several different medical reasons, including obstruction, scarring, prostate enlargement, nerve damage, and more. UTIs can affect any part of the urinary system, including the kidneys, ureters, bladder, and urethra. According to the Centers for Disease Control and Prevention, urinary tract infections are the most common reported hospital-acquired infection. Approximately 75% of UTIs acquired in the hospital setting are associated with urinary catheter placement. The CDC also states that between 12 and 16% of hospitalized patients received an indwelling catheter at some point during their hospital stay. Prolonged use of urinary catheters are a major risk factor for developing a CAUTI, thus making it imperative to remove catheters as soon as they are no longer medically indicated. CAUTIs present complications for patients and healthcare professionals, including increased length of stay, discomfort to the patient, increased costs for healthcare systems, and increased mortality rates among patients. It is important that the healthcare system provides evidence-based CAUTI prevention practices and strategies to eliminate these complications and keep patients safe. CAUTI prevention is extremely important to nursing as it is considered a nursing-sensitive indicator by the National Database of Nursing Quality Indicators. This means rates of CAUTIs are analyzed quarterly and annually to evaluate the quality of nursing care at the micro and macro level. Additionally, hospital leaders, the Centers for Medicare and Medicaid Services, the Joint Commission, and other regulators use quality indicators to assess the level of care nursing staff provides on the macro level. Specifically, CAUTIs are classified by the Centers for Medicare and Medicaid as a never event. This means they can cause serious injury or death to patients and generate increased costs for hospitals. As of October 2008, the CMS will not provide reimbursement to hospitals for never events, incentivizing hospitals to eliminate never events altogether to prevent increased expenses and poor patient outcomes. According to the Agency for Healthcare Research and Quality, the estimated total U.S. cost per year for CAUTIs is $340 to $450 million. The approximate additional cost per patient for a CAUTI is $1,300 to $1,600, according to a research study done by Wald and Kramer. Maintaining sterile technique while inserting urinary catheters, providing high-quality catheter care, and ensuring timely catheter removal are all within the domain of nursing practice. Since nurses are at the forefront of catheter placement and maintenance, CAUTIs can be regarded as an infection caused by nurses when they do occur. Nurses are responsible for acquiring the appropriate knowledge and procedures of catheter care that will prevent CAUTIs and the complications associated with them. CAUTIs can lead to such complications as prostatitis, epididymitis, orchitis in males, cystitis, pyelonephritis, gram-negative bacterium, endocarditis, osteomyelitis, septic arthritis, and so much more. The complications associated with CAUTIs can cause discomfort to the patients, prolonged hospital stays, increased costs, and mortality and morbidity rates. There are multiple evidence-based CAUTI prevention plans available across numerous nursing databases for hospitals to implement. The CDC offers a comprehensive CAUTI prevention toolkit, including core strategies and supplemental strategies based on the Healthcare Infection Control Practices Advisory Committee. These recommendations are written by Gold et al. The core strategies defined by the CDC and Gold et al. Include inserting catheters only for appropriate indications, leaving catheters in place only as long as needed, ensuring that only properly trained personnel insert and maintain catheters, insert catheters using aseptic technique and sterile equipment, following aseptic insertion and maintaining a closed drainage system, maintaining unobstructed urine flow, implementing quality improvement programs to enhance appropriate use of indwelling catheters and reduce risk of CAUTI, and hand hygiene and standard precautions. Supplementary strategies include considering alternatives to urinary catheters altogether, using portable bladder scanners to assess the urine volume and avoid catheterizations, and the use of antimicrobial, antiseptic, impregnated catheters. The Association for Professionals in Infection Control and Epidemiology also created their own guidelines for CAUTI prevention. These guidelines explain that current strategies should focus on determining if catheterization is a necessity and evaluating the clinical justification daily until the catheter is removed, rather than interventions after catheter placement. This bundle includes verifying the need for a catheter prior to insertion, maintaining aseptic technique, and properly maintaining the urinary catheter after placement. As seen below, there are multiple steps under each of these categories to help with CAUTI placement and prevention. The APIC also created a CAUTI maintenance bundle that prompts nurses to consider if they have assessed if the catheter can be removed daily, if the tamper evidence seal is intact, if the securement device is in place, if they are performing hand hygiene prior to patient contact, if the patient is receiving daily meatal hygiene, if the drainage bag is being emptied with a clean container, and if the flow of urine is unobstructed. This bundle urges nurses to answer yes or no to each question and determine if the Foley should be removed or continued. The CAUTI maintenance bundle should also be implemented across nursing units to assist nurses in preventing infection. The CAUTI insertion and maintenance bundles, along with the CDC's recommendations, can easily be implemented throughout nursing units to help prevent unwanted nosocomial infections from Foley catheters. Nursing leadership can share CAUTI data and educate nurses regarding the use of preventative techniques. These bundles should be added into the EHRs so nurses can fill them out efficiently. The EHR system should be set up to alert nurses if they need to complete the bundles and ask nurses if removal is appropriate. A microsystem approach to CAUTI prevention would involve implementing the APICS, CAUTI insertion and maintenance bundles along with the CDC guidelines for prevention of CAUTI on one specific nursing unit and evaluating the effectiveness. To choose which unit to implement the CAUTI prevention plan on, data from the hospital's nursing quality indicators should be evaluated to determine the unit with the highest prevalence of CAUTIs. Once the unit was determined, initiation of the CAUTI insertion and maintenance bundles and guidelines would begin. Education would be given to all of the nurses on the unit prior to implementation to ensure proper understanding of the tools. After 3 months of the CAUTI prevention plan, data from before the implementation and data at the end of the 3-month period would be compared to evaluate the effectiveness of the plan. A study by Carr et al. In 2017 implemented a similar CAUTI prevention program on a microsystem level of a 27-bed progressive care unit. The study included a CAUTI prevention form and a CAUTI bundle audit tool. The forms were posted in each patient room, visible to all staff, and accessible for editing information. It was found that after the prevention plan was initiated, the microsystem achieved and sustained a CAUTI rate of 0 for 22 months with a 38% reduction of catheter days. This data helps to enforce the CAUTI prevention plan proposed above and its potential success. According to Nelson et al. 2007, the macrosystem method of improving outcomes involves the entire hospital system and each part of the system becoming aligned with a goal of organization-wide improvement. After the CAUTI prevention plan proved to be successful on the microsystem level, it could then be utilized hospital-wide. Evidence would be presented to senior leaders and middle managers to gain support. Nursing leaders from each unit in the hospital would be responsible for educating their respective units on the CAUTI prevention plan and explaining why it is extremely important to patients in the healthcare system. Progress and performance would be reported to senior leadership regularly to ensure continued support and access to resources needed for hospital-wide implementation. Hospitals can use nursing informatics to implement CAUTI prevention plans promptly and efficiently by using their electronic health record systems. McGonigal and Mastrian 2022 explain that EHRs have clinical decision support systems installed within them, and such systems can promote accurate medical diagnoses and suggest appropriate evidence-based medical and nursing interventions based on patient data through alerts and care reminders. It is explained that EHR systems are very customizable and may be adapted to have trigger algorithms to suggest the use of CAUTI prevention bundles and folio removal assessments. A research study by Weldon in 2013 assessed the efficiency of using the EHR to help decrease urinary catheter usage and infections. Weldon 2013 embedded an evidence-based criteria for urinary catheter placement in the EHR and on the Continue to Meet drop-down menu, from which the nurse could select an applicable reason to continue the urinary catheter. If the EHR noted that the patient did not meet the criteria for maintaining a urinary catheter, the nurse was notified by electronic request for possible removal according to hospital policy. Weldon 2013 found that within the first 6 months of implementation, process improvements in care practices increased by 47%, and the number of catheter insertions showed a downward trend from 30% of patients using a catheter at baseline to 25% 6 months post the implementation. In another research study by Bailey et al. 2014, a computerized clinical decision support intervention was integrated into an electronic health record at one healthcare system to help reduce prolonged urinary catheter usage. The providers were prompted to provide an indication for urinary catheter insertion upon order entry, and if it was not removed within the recommended time, nurses and providers were both alerted to reassess the need for the catheter. Over the 3-month time period evaluated in the study, CAUTIs per 1,000 patients a day declined significantly. Overall, it is very important to note the effectiveness of utilizing EHRs in the prevention of CAUTIs and the opportunities that EHRs create to provide higher quality care. With CAUTIs causing numerous complications, including death, it is imperative that hospitals have a CAUTI prevention plan in place to prevent such complications from occurring. Implementing the APIC's CAUTI insertion and maintenance bundles and the CDC guidelines for prevention of CAUTIs. Both have been proven through extensive research to drastically decrease the rate of CAUTIs. Additionally, EHRs have proven to be effective in decreasing the rate of CAUTIs as they can be customized to have trigger algorithms that suggest the use of CAUTI prevention bundles and Foley assessment removals. Overall, it is important to note the effectiveness of the APIC's CAUTI insertion and maintenance bundles, the CDC's guidelines for prevention of CAUTIs, and EHR clinical decision support systems in the prevention of CAUTIs because they can significantly improve patient outcomes and create a safer care environment. Thank you for listening to my presentation on CAUTI prevention plans. If you have any questions, just email me at emgugle@svsu.edu.